Hey Cassie, so we just finished trying to get you up to go to the bathroom and you weren't able to go after we encouraged you to drink a lot of water, did all the tricks and stuff. And you did just agree to do a urinary catheter. It is a sterile process. I'll talk you through it, and at any time if you're uncomfortable or want me to stop, just let me know and I will stop immediately. Do you have any questions? Okay, so right now I am just going to leave, wash my hands, and then come back and we'll start the procedure. You can just relax now, and when I come back, we'll talk about, positioning. Okay, bye. Okay, so I am back and I just washed my hands. So we're just going to start off with you laying down and butterflying your legs, kind of similar to what it looked like when we did an exam, a cervical exam earlier. Okay, so as you're doing that, I'm just going to set up my sterile field. So here is my sterile gloves. It is still in the packaging. Um, Touching the outsides. Here is my sterile lube. Putting a little dollop on the corner. I'm just going to put that here to keep it close. And then here is my catheter. It is still wrapped up for this purpose. And I'm just going to drop it on the sterile field using aseptic and sterile technique. And then here are my iodine swabs. I did rip it open and I'm going to put it right here up out of the way so that I can just get the swabs as needed. I do have gauze just in case if I need it for anything. So we're just going to again just start with me putting on my gloves. Okay, now I'm going to get my other glove, pick it on. Okay, so now I am going to put one of my hands on your outer thigh, and then I'm going to open your labia, and then it will just be me cleaning, like locating your urethra and then cleaning that area as best as I can. So here's my touch on your thigh. Is that still okay? Okay, so now my hand is on your labias. And again, if you feel uncomfortable anytime, just let me know. Here's the iodine swab. I'm just going to swab down, swab that area one time, discard that. I'm going to take another iodine swab. Your labias are still open, and I'm just going to come down and swab. Perfect. Now I'm going to get the catheter. Use some lube to put lube on that area. Again, here's my touch. I'm going to open your labias again. How are you feeling? Okay, so now I have located your urethra. So I am just going to, would you like for me to count down? No? Okay. So I'm just going to insert the the catheter inside your urethra. And it's in. I'm going to go a little further. I do see some urine, so I'm going to put it in a cup until you start peeing. Look, you're doing such a good job. It's alright, so starting to slow down. I'm just going to press in the middle, lower half of your stomach just to make sure, just gently. Okay, perfect. So now I'm going to start taking it out a little bit, pulling it out, pulling, pulling, pulling. Perfect. It is all out. And we're all done. Good job.